with our immunocompromised patients, our patients can be immunocompromised for a lot of different reasons. They could have a cancer that affects the bone marrow that may not produce normal white blood cells. Chemotherapy that's used to treat cancer suppresses cancer cell reproduction, but also can suppress the bone marrow. Medications can be given that can have a side effect of suppressing the immune system, like corticosteroids. Patients who've had organ transplants, patients who have HIV or AIDS, things like that. With these patients, they're at risk for infectious diseases and cancers that are normally rare or not found in the general population. And any patient who is at risk, or any patient who has immunocompromise, assess for signs of infection, fever, cough, night sweats, things like that. Also keep in mind that these immunocompromised patients are at a higher risk for infection from exposure from medical procedures, from us, the healthcare workers, and the environment like the ambulance and other patients. So a lot of time PPE here is not only for us, but for the patient's sake as well. Now with your autoimmune disorders or diseases, normally the immune system is pretty good at distinguishing either self or non-self. And non-self will be attacked by the immune system and self is not. Well, in autoimmune disorders, the immune system doesn't do this. It doesn't recognize things in the body as self, and it starts working to attack them and destroy them. And this is going to affect the function of whatever the tissue is that they are attacking and destroying. A lot of the times treatment for autoimmune disorders is to suppress the immune system. But with that, they're less able to fight off infectious diseases, cancers, things like that. So some of your diseases that you just need to be a little bit familiar with here. Rheumatoid arthritis. This is a vascular disease that's going to affect the joints. The smaller joints in the hands and toes, feet are usually affected first, but other joints are affected over time. They come with joint pain, swelling, stiffness, and eventually can lead to deformity and loss of use altogether. With your psoriasis, this is a rapid cellular reproduction that results in patches of scaly, thick skin, and they get better and worse and better and worse. The most common areas affected are the elbows, the knees, the scalp, but they can be widespread. Now, this is not contagious in any way, and people sometimes kind of freak out about it, but it is not contagious. Scleroderma is inflammation in the skin and blood vessels, and it forms scar tissue. And when the skin and other organs become fibrotic from the scar tissue, they don't function as well. And patients can have flare-ups and then go back into remission and then continuous cycles of that. For your systemic lupus, this is more common in women. Your signs and symptoms are going to be fatigue, fever, joint pain, and rash, and it can also affect the function of the kidneys, the heart, and the lungs. Now, with all of those, there's nothing we can do for them except for comfort measures and transport, monitor, ABCs, and things like that.